Can pelvic floor physical therapy cure permanent bladder issues? Can pelvic floor physical therapy really cure permanent bladder issues? This is a question many people have when exploring treatment options for bladder health. Pelvic floor physical therapy, often abbreviated as PFPT, can significantly improve many bladder issues, especially those related to pelvic floor muscle weakness or dysfunction. However, it is not generally considered a cure for all permanent bladder problems. PFPT is a highly effective conservative treatment aimed at restoring muscle strength, coordination, and control. This therapy can help reduce symptoms like urinary urgency, frequency, leakage, and pelvic pain. The pelvic floor muscles play a crucial role in supporting the bladder, urethra, and other pelvic organs. When these muscles weaken or become damaged due to factors like childbirth, aging, surgery, or cancer treatments, it can lead to urinary incontinence and overactive bladder symptoms. The therapy typically includes exercises such as Kegel exercises, biofeedback, and sometimes electrical stimulation. These methods work to strengthen and retrain the pelvic floor muscles, which can improve bladder function and alleviate symptoms. Research indicates that PFPT can effectively reduce symptoms of overactive bladder, urinary leakage, and frequency, enhancing overall quality of life. Some studies even report significant symptom improvement or resolution in certain patients after dedicated therapy programs. However, the extent of improvement can vary based on the underlying cause of the bladder issue, its severity, and individual patient factors. For permanent bladder issues caused by irreversible damage, such as severe nerve injury, extensive pelvic organ prolapse, or bladder cancer treatments that alter bladder structure, PFPT may not fully restore normal bladder function. Nonetheless, it can still provide meaningful symptom relief and improve pelvic floor support. In the context of bladder health and bladder cancer, PFPT is particularly valuable for managing urinary symptoms that result from cancer treatments like surgery or radiation. While it may not cure permanent structural changes, it helps patients regain control and reduce complications related to bladder dysfunction. In summary, pelvic floor physical therapy is an important, evidence-based treatment that can improve or even resolve many bladder control issues by strengthening and retraining pelvic floor muscles. However, it is not a universal cure for all permanent bladder problems, especially those involving irreversible damage. For the best approach tailored to individual needs, patients should seek personalized evaluation and treatment from healthcare professionals specializing in pelvic health.